historically, drug companies, I'm glad that they make drugs that help people with ailments, but they are also capable of tremendous corruption.
Hello everyone, I'm Will Witt, Editor-in-Chief of the Florida Standard. I am joined by Florida Surgeon General Joseph Ladapo. Thank you so much for being here today. We're really excited to do this interview with you.
Yeah, great to chat with you, Will.
So Florida has really been the pioneering state for a lot of what has happened with COVID. I think Florida made a lot of decisions and then a lot of states followed suit that had a freedom agenda. How do you think that when it comes to potentially another pandemic around the way, how do you think Florida would respond to the next one?
I think everyone knows how Florida would respond so long as Governor DeSantis is at the top, and he gets the credit. I mean, what he did was really remarkable. You had 99 voices out of 100 who were telling everyone to shut down, stay shut, to keep the schools closed, to force everyone to wear those highly effective masks. And he didn't go to medical school. And Governor DeSantis managed to connect with some very smart doctors like Dr. Jay Bhattacharya, Dr. Martin Kulldorff, very smart doctors and epidemiologists who are very familiar with the evidence and didn't come with a big agenda, which I think is pretty clear to most people now that was a huge component of the pandemic, and just prescribe policies that made sense. So that is certainly Governor DeSantis's way. And honestly, I'm not really sure what other states would do. I mean, other states have just not been anywhere near as proactive, as clear in intention and action as Florida has been. And I hope they catch up. I think they will. I hear a few things here and there that some states, but a lot of people, right, not California. But it's interesting because I think a lot of people are just really intimidated about saying something different than the public health officials and Dr. Fauci.
Right. Well, something that you just mentioned there was common sense. And you have this new Public Health Integrity Committee, which I think a lot of people have said is the anti-CDC, right? But that deals a lot with common sense. And so what does that actually look like and what does it entail?
There is a component of common sense, but honestly, the biggest factor, the defining factor of it is integrity. So yes, common sense can tell you, even if you're not a doctor, that you shouldn't be trying to stick stuff on the faces of little kids. But the evidence actually also says that there is no proven benefit of that, kids or adults. There's just not a proven benefit of that. The studies that have been favorable, almost all of them have been observational. Almost all of them have some degree of confounding. The strongest evidence is not supportive of it. And the Cochrane Review just released a new review on masks that again found that community masking wasn't an effective strategy for stopping respiratory viruses. So we have a public health integrity comprised of great scientists, Dr. Jay Bhattacharya, Dr. Martin Kulldorff, Dr. Tracy Hogg, Dr. Brett Weinstein, Dr. Joe Feynman, and other terrific doctors, smart physicians and researchers who have integrity and will interpret the data in the way that is most aligned with logic and fact rather than with politics, which is what you have to describe it when people are still talking about masks when another systematic review that included clinical trials that were done during the pandemic found no overall evidence of a benefit.
But what it seems like is that many people at the beginning of the pandemic, when they saw the masks and you saw them starting to talk about vaccines and the lockdowns, there were a few people who were very skeptical, but it seemed like the mass medical community seemed to be completely duped. I mean, you have these mRNA vaccines with the COVID vaccines that didn't have any sort of long-term data, yet they were pushed out even for children. How do you think that happened, that people got so, maybe the word is duped, on all of these different medical malpractices?
I mean, it's a great question. It's the $1 trillion question, maybe. I think a number of things were going on at the time. We were just talking about Los Angeles, and I was at UCLA. I was a faculty member in the Department of Medicine, tenured faculty member with multiple NIH grants, and and I had colleagues, very smart colleagues, and clearly people who knew how to produce evidence and interpret evidence, who still just wouldn't accept that the high quality evidence clearly showed no overall benefit from masks. In that case, I think politics was a piece. Looking back at it, I had a pretty liberal department, and I think there was a Trump factor also in terms of being on whatever the opposite side. I mean, certainly if Trump had promoted it, I think things would look differently. Things would have looked differently in terms of the masks, and there were other things. I think we've seen that historically drug companies. I'm glad that they make drugs that help people with ailments, but they are also capable of tremendous corruption. Look back in history, recent history. Right? Pfizer, huge fines recently for basically misrepresenting a product that they made. You look at Vioxx, made by Merck, enormous fines for hiding. And you have to conclude that they were hiding because they had these data on the effect that their drug had on heart attacks. But they didn't, the data weren't disclosed. And finally, it was essentially pulled out of them. Huge fines for that. So these companies, I think that they contributed to the illusion of consensus and of this is the right thing to do to give people drugs, which is these vaccines that we don't know the long-term effects of, so I think they played a role also. I think and certainly the media played a role, and heaven knows what their full agenda is. Only God knows what all is hiding behind there, and the Trusted News Initiative and their funders and whatever the heck they have in mind in terms of their vision of what the world should be. But so I think there were multiple forces, but I think really the important thing is that people get grounded in reality and their common sense and their intuition, just so that dumb, harmful things like that don't happen again.
Well, you brought up Big Pharma there, which I think is pertinent to the conversation because there was a Gallup poll that actually said Big Pharma is really, to a lot of people, the worst type of companies in the nation as viewed by Americans, right? They don't have a very favorable view of Big Pharma companies. So what is Florida going to do to hold these companies accountable for this type of corruption that you talked about?
Yeah, Florida's doing a few things. I think one of the major things that we're doing, before the really exciting thing we're doing, one major thing we're doing is that I think we're going to see some legislation this term that's going to address pharmacy benefit managers and just the lack of transparency and the lack of really patient-oriented policies in terms of how people access the medications, whether by mail or in person, and the price that they pay. So Florida's doing that, and Florida also has been trying to work with the federal government to take advantage of a law that allows for drugs to be imported from Canada. That's something else that is happening, but we've been getting a lot of slow responses from the federal government, and you can be pretty sure that more than likely the pharmaceutical lobby is the cause for that. I mean, they're an enormous lobby. They're one of the biggest. So that's some of the stuff that we're doing. I think the really exciting thing that we're doing with Attorney General Ashley Moody is the move to really hold them accountable for any deception or dishonesty that they enacted during the pandemic, particularly in regards to language about stopping the spread with these vaccines when that wasn't measured in the primary clinical trials. So my hope is that we're going to see a lot more exciting things coming from that.
In general in Florida, how do you think that healthcare needs to change, or maybe not just in the state, but nationwide, to make it actually better for citizens?
That's such a complicated question. The challenge in the United States, and for anyone who's interested enough in this stuff to learn more about it, there's actually a really great book. It's called The Social Transformation of Medicine, and I think the author is Paul Starr. I can't remember the exact author, but it's a really great book that describes the evolution and how healthcare, the administration of healthcare has evolved in the United States, and it's a really remarkable story. in terms of how healthcare went from essentially sort of a grassroots, completely decentralized system that, there was a lot of stuff that didn't help people, of course, to an organized system with a lot of organized political power. And that is responsible for what we have today, which is a huge mess in terms of the industry. So the issue of healthcare is a challenging issue nationally because there are so many factors and so many interests, and particularly financial interests, that define how healthcare is delivered. My focus on health as Surgeon General is really more on prevention. So you got to imagine that we had a pandemic where it was known very early, that obesity was a major risk factor. And I don't recall a word about that coming out of Dr. Fauci. Like, what can you do to strengthen your immune system, to strengthen your body, to be a healthier being? And that's been my focus. And that's something that I want to continue to really support and push, both through example, participation in like 5K runs and things like that, and other ways, but really prevention and helping people eat better, sleep better, drink more water, exercise, move their bodies, sunlight. That's where my focus is, and I think that's where the most value is.
Well, if you can help me get some more exercise, I'd really appreciate it.
Here's the trick. Do it.
Yeah, exactly. It's not easy. Hey, Dr. Joseph Ladapo, thank you so much for joining us today and doing this interview. If you guys enjoyed this, make sure that you share this video, drop a comment down below, make sure you subscribe to our newsletter, and we're going to see you in the next interview. Thank you guys for watching.